Now, we have an exclusive for you. GB News has uncovered a shocking survey that's been sent out to thousands of children as young as 11 years old.
Yes, the survey warns that, we should warn you that the following content might be distressing for some viewers. Parents have raised concerns that it could plant the seed of self-harm in children's minds, making them question if they were born in the wrong body and give them tips on what illegal substances they could use to get high.
Yes, so the survey is published by the Schools and Students Health Education Unit, and it's been sent out to every secondary school in Surrey. It's also emerged that it's even worse than we thought. It's been sent out to all areas of the country, according to the council. And it contains some rather odd questions.
Have you taken drugs to get high? The survey asks people 11 years old. It goes on to mention all sorts of drugs I'm sure some of the children will never, ever have heard of.
And they also ask about gender, asking, is your gender now the same as the sex you were assigned at birth? Assigned at birth, with 4 options to choose from.
And finally, when you have a problem that worries you, or you're feeling stressed, what do you do about it? Well, children have options to tick, including have an alcoholic drink, smoke cigarettes, or even cut or harm yourself.
OK, well, we're delighted to be joined by one of the parents who's spoken up about this, Lisa McKenner, and we're also joined by Miriam Cates as well. Now, Lisa, you got in touch with me and you flagged this survey because you were concerned as a parent that your child had been given this to fill out.
Yeah, I mean, my daughter came home from school, she was very confused. She was asking why somebody would want to hurt themselves if they were feeling sad or worried about something. So that led to a conversation that we had, and I actually phoned the school and asked them to send me the survey, which with a lot of pushing, they eventually did send me the survey. And when I read through it, I was just completely shocked at the content of it. Very concerned. There's lots of vulnerable children in schools, very impressionable. There are many autistic children in schools that would read a lot of what's in here as a matter of fact. If the survey says, when I'm feeling worried, that maybe I should try cutting or harming myself because it's in the survey, so that must be an option. I've tried everything else, so why not try this?
It is astonishing that some of these are young children who are perhaps being introduced to these, these abuses for the first time.
Yeah, I mean, there's a list of 17 different types of drugs, some of which I've actually never heard of myself. The solvent areas I find is very concerning because a lot of those are very easily reachable for children and they may give them a go. I mean, the wording on here is, have you ever got high from taking drugs? I mean, these children, some of them, my daughter is 11 years old. She would never have thought of this.
And were you told before that this survey was going to be given out? Were parents given the option to sort of opt out of this?
There was a very genetic email that went out to the parents that said that there was a survey going out. If you'd like to view it, make an appointment to come into the school. It wasn't easy for parents to take time off work, to come in, make an appointment to view it. And to be honest, I never expected it to contain anything like this to be given to children.
And Lisa, you really struggled to get this survey, to see it in its full form. Why was the school so reluctant to show the parent what the children are filling in?
I don't really know, to be honest. It was difficult. The only way you could view it was to have an appointment, but after lots of to-ing and from the school, eventually they did let me have a link to view the survey.
Yeah, I mean, it seems very probing. Miriam, let's bring you in, Miriam Cates. What do you make of this survey, these types of questions being asked of 11-year-olds?
Well, I mean, it's absolutely appalling, and we know that some of these behaviours, self-harm, gender dysphoria, taking drugs, are psychologically contagious. Children do them because they see other children do them, or they find out about them from the internet or from surveys like this. So the idea that this is just information gathering and won't go any further than that is ridiculous. There was a similar survey in Scotland, I think, about 3 years ago, where children the same age, 11, 12, 13, were asked about their sex lives. How many times have you had sex in the last year? How did you have sex? Did you use contraception? Totally normalising underage sex. So the idea that children are just mini adults and we can confront them with all the same kind of ideas ideas and dilemmas that adults have to face is just ridiculous. And the other disturbing side of this is the kind of confidentiality, the idea that schools want to hide these things from parents.
Yeah, and they say this is anonymous. But what do you make of the point where, so this is the Surrey County Council, they said, unfortunately self-harm is an issue which affects a proportion of young people. We believe it is vital to include questions on important issues such as this to enable the right support to be put in place locally and nationally. So they're suggesting there that the results of these surveys will help inform potentially public services and things. What would you say to that?
Well, I think it's all part of this same false but very prevalent idea that you can educate children to protecting themselves. And this is exactly the same as we've sort of seen in the grooming gang scandal, that as long as you educate children to recognise abuse or recognise self-harm, then we can do something about it. Of course that's not true. Children are not able to, A, recognise and B, protect themselves. That's what adults are for. We should be teaching adults to recognise the signs, not telling children all the different kinds of things that they might be able to do if they're upset or if they want to have sex or all those kind of things. It's completely upside-down idea of childhood. It's at the root of all these things.
I think the assigned at birth as well. For your
what 11-year-old would know what that meant?
Yeah, I think that's rather confusing. But the shopping list of drugs seems rather bizarre.
Although I can understand the good intentions behind this. Policymakers at all levels of government want to know where there are problems. We always read reports in newspapers or in policy papers or whatever saying X% of 12-year-olds have tried this, X% of 14-year-olds are sexually active. That data has to come from somewhere. Miriam, is there any better way that we can learn and understand what is actually going on in the country? Because I can see the sort of folly of this. Having been an 11-year-old boy once myself, I might not have answered this entirely truthfully. I mean, I might have taken this as a joke.
Quite probably some children will. And look, when children end up, sadly, in hospital because they have self-harmed, of course, those statistics are added to a national database. So we know accurately how many children have been hospitalised or treated for self-harm. But that is different to exposing children who have never even thought of it to the idea of it. It's, again, the same with sexual abuse. The idea behind teaching 4-year-olds what sex is and how you can touch yourself, etc., is apparently to protect them. But, of course, all it does is make them more vulnerable to groomers because suddenly these ideas enter their minds. So, yes, I don't doubt that it's well meant, although it is telling that in all these cases, whether it's this survey, the Scottish survey, sex education, schools are desperate to hide these things from parents, which shows that they know there's something in it that isn't quite right.
OK, well, thank you very much, Lisa McKenner. Thank you so much for coming in and alerting us to this survey as well, and Miriam Cates, of course, as well. Now, we did reach out to Surrey County Council, and they said it's a tried and tested holistic survey which provides extremely valuable information and insights to understand the health and well-being experiences and behaviours of children and young people. On the question of self-harm, they say the specific question related to self-harm is a standardised question which is used across the country, an issue which affects a proportion of young people, and we believe it is vital to include questions on important issues such as this to enable the right support to be put in place locally and nationally.
And the school's health education unit, providers of the survey, went on to say schools opt in to do the survey. Pupils are advised that they don't have to answer any questions they don't wish to answer. Parents are asked if they want to withdraw their children from the exercise. All parents have the opportunity to view the questions and exclude their child if they think their child is not yet ready for such topics. They go on to say we would much prefer that pupils encounter subjects such as self-harm or substance abuse in a supportive environment, with trained staff on hand to discuss any concerns and dispel any myths.
OK, well, let us know what you make of that. gbnews.com/your say. Would you be happy if your child received such a survey at school? But